Go ahead and call this Public Health Subcommittee meeting to order. Let's stand for invocation. Father, thank you for this day. Thank you for the opportunities that you present to each of us individually and as a group. May we use everything we say and do be pleasing to you. And we just thank you for just being here with us, overseeing all this. In Jesus' name, amen. Amen. I had Shelley place on your desk there minutes of our last subcommittee meeting was 2 months ago. You didn't know it, but you've already approved these minutes.
All right.
I remember that. Junior remembers, so we don't even need to have minutes anymore. But certainly you can look through that to see what ground we covered 2 months ago. So we're ready for reports, and I'm glad. Roll call. Shelley, go ahead.
Mike Dobbins.
Here.
Keith Austin.
Here.
Charlie Buzzard.
Here.
Tom Crittenden.
Here.
Joe Deere.
Here.
Shannon Duncan.
Honey.
Rex Jordan.
Here.
Daryl Lett. Wes Snowfire.
Honey.
Dora Kutzkowski.
Here.
Mary Baker Shaw.
Honey.
E.O. Smith.
Here.
Denise Taylor. Here. Tori Vesquez.
Honey.
We have a quorum.
Good turnout, no? Okay. All right, Lisa, Miss Lisa Pivick's going to come and share her report with us.
Good morning. Happy New Year. This is my first meeting with you since 2020 has started, and I'm pleased to be here this morning. Dr. Gann is running a little behind. He's stuck in that traffic issue up the road, but he'll be here momentarily, so I'll do my reporting. And then he has some updates. He was in meetings yesterday at the state on the novel coronavirus and updates on where we are with that. So he wanted to update you on those issues and the issues with the physical activity survey. Dr. Garrett is also accompanying him when they get here. So if you should have your report from December, January in your packet. I'm experimenting with ways to make this report more efficient for you, so this time I tried an executive summary with a table of contents so that you could flip back to your community and review what's going on specifically in your area should you choose. A couple of things that I would like to mention today as we lead into 2020, under the report under monitoring and surveillance, you will see that we continue to talk about the tribal health assessment and the tribal health improvement plan and the update of those. That is one of the requirements, as we've mentioned before. In August of 2021, we will be up for reaccreditation from the Public Health Accreditation Board. And the work that we're doing now are those prerequisites, and there are efforts as part of the reaccreditation. But the more important work is that we're working to become a more comprehensive system that works together to achieve the ultimate mission of the Cherokee Nation and Cherokee Nation Health Services, which is to ensure the story of the Cherokee Nation continues. And so as you'll see that we are continuing to gather feedback from citizens on health needs and priorities in their communities. We finished the Adair County, and I did mention this in December, and if you missed that, it's on the public health website on the opening page that you can review that tribal health assessment that was conducted by the Lynn Institute. It's up for you to peruse at your convenience. We just initiated, and we have a meeting next week with the Lynn Institute to start 4 additional counties, which the goal is to have those done by the end of this year, and that will be Cherokee, Mays, Delaware, and Sequoia counties. And we're meeting with them on how we're going to conduct the work this time. As you remember, the Adair County assessment took off after the life expectancy, small populations life expectancy survey data, and this one will be a little bit different because we're going to potentially ask different questions of the key informants and guide that work with the key informants in the community surveys, as well as take a look. And a lot of the prerequisite work was done when they did Adair County because they looked at the other counties for comparison. When you look at that report, you'll see that. So we'll have a little more time, I think, to do a little more deeper dive into what I would say were qualitative data in those particular communities. As we start 2020, I'd like to make a few goals or promises for 2020 that I'd like to have with you and the executive branch and our citizens. I would like to tell you that for this year, what we would like to do is one, continue to inform you on the status of the Cherokee Nation's health while still embracing the tribe's role as the original stewards of public health. That's what makes us different at Cherokee Nation and Cherokee Nation Public Health as we go through these tribal assessments, tribal health improvement plans, and the work, is to really understand that we have the freedom, the sovereignty to be a self-determined tribal public health department and find out what works for us. And we pledge to do that. We know that we have the responsibility to protect the health of our people that exists beyond just healthcare delivery, but also health in our communities. We will collectively work this year to define public health authority and communicate that to our external partners, especially our federal partners. Tribal Public Health Authority is about determining our future and strengthening government-to-government relationships. Next month, I will be attending the Tribal Advisory Committee at CDC, and we will be discussing some of these same issues about Tribal Public Health Authority. I think that as we move through 2020 and we define those things and we share that with our partners, possibly I hope to avoid a situation like the small populations life expectancy study again, so that those issues are more done in a mutually beneficial way so that they understand our populations and how they can help and serve us rather than cause undue harm in communities. And I'll speak to that when there are questions about that small populations life expectancy study. I can speak to that as well. And another pledge that I want to make to you in 2020 is that we will strive to ensure our services are well coordinated. Working together across the continuum of care, we promise to reach out to all partners within health and outside the boundaries of the health services to make sure that we can provide the best services to our citizens. And in doing that, we want to also engage our citizenry in that, figuring out ways to, we've done quite a bit of qualitative assessment in communities at this point, and we're looking at what's working and what's not working, and we want to keep trying again and again to hear the voice of the citizens that live in our communities, because that is the reason that we exist, and we want to make sure that those voices are heard and incorporated into all the work that we do. Let's see, I had a couple more points I wanted to make. We did, when Dr. Garrett and Dr. Gann arrived, we did meet with Dr. Dobbins with a pilot look at a District 4 deep dive into that physical activity survey that we did and providing recommendations with that. We talked quite extensively, and Dr. Garrett has gone back and revised some of the maps to be a little more along the line of what we talked about and how we might inform each district separately. And be happy to start setting up those appointments with you if you want to look at your individual district. I think that it's best done in a situation where we can sit down and have a dialogue and really investigate the information. And if you'll remember, the entire purpose of doing it this way was not to do an aggregate look at the entire Cherokee Nation, but it was to look at just the districts alone and look at the differences and the disparities. Let's see. As I mentioned earlier, Dr. Gann will be here to talk about our response to the novel coronavirus. CDC life expectancy survey revision. I was told there was an article in the Tulsa World, and then I was also told there was one in the Daily Oklahoman about that, and wondered if there were any questions. I'd be happy to entertain any questions. I had read some comments from our citizenry and wanted to clarify that this was not a phone call or a telephone discussion, but this was actual formal communication between us and the CDC, and I have the emails, and they said they would be issuing that revision of that very quickly. So, and if there are any questions about what they discovered, I'm happy to answer that.
Well, where did the error happen? What happened? What made the error down there, Lisa?
Well, what it appears and what the lead author communicated to me was that in rural the use of P.O. boxes in rural populations was not understood fully to them. So in some communities, when you have a P.O. box in a certain census tract, I assume that the P.O. box coordinates with that census tract and you actually live there. If you're familiar with Adair County, you can live at Peavine and have a P.O. box, and that P.O. box resides in Stillwell. So they not understanding that P.O. boxes were not indicative of where the person actually lived. And then we knew there was something because in some of those census tracts, I believe the one to the west had no des for 6 years, and we knew that couldn't be correct. So that's where it came in, and they're not going to be able to do, there's 3 census tracts, 4, 5, and 6, I believe it is, or is it 3, 4, and 5? I'm not really sure. But those tracts are going to have to be combined together for that life expectancy because of the not being able to actually map those P.O. boxes to a residence. So I don't know if Dr. Gain has anything to add to that.
We noticed those disparities right off the bat when we initially read the paper, and we reached out to the OU Hudson College of Public Health. They have an expert on survival analysis, and we went through the paper with them. Says something's not right, and we went straight to CDC the next week, and they said yes, we'll take a look at it. And it just took them a while to get to this point. So the P.O. boxes, and it makes sense that the census tract around Stillwell geographically is very small, right? And so someone just lives a couple of miles away and they have a P.O. box in Stillwell. The death certificate says they lived in Stillwell when they didn't. So it's as simple as that. And the way they collected the data is they asked the state, send us all your death certificates. Then they sent those death certificates to the Department of Housing and Urban Development that has a big system to put addresses on a map. And then they sent that data to CDC. And it was 65,000 census tracts. So it was a lot of data. And when it all came out, Stillwell was at the bottom, and they didn't raise any flags for them. They said, oh, that's just the way, this seems to be okay. And it wasn't. And so that's our task, Lisa's task at the Tribal Advisory Committee, to say you can't do that. It is important to us. So please let us work with you in the future.
Interestingly enough, Dr. Gain and I have been discussing, so now we know Stillwell is not the death capital of the United States. And so Dave mentioned to me when we first talked about this, he said, well, who's next? Who's the next one? What's going to happen? And ironically enough, I received a phone call from that particular a health official in that area yesterday who said, now we've got the stat. What did you do? How did you? And asking what we did to dig into it, because they too don't believe that it's accurate for their communities. Because I believe that life expectancy was in the 50s as well for that community, for that census tract.
I spoke with the director of the Division of Health Statistics at the State Health Department yesterday, and they're looking into those other census tracts that had low numbers and the data that they sent to CDC to see if those need to be revised as well. So we'll see.
Mary?
Yes. You know, I want you to know how grateful we all are that you were so persistent in seeking out why this was happening in Adair County. We will forever be grateful what you have done for this tribe. It's astounding, and we are so grateful, and I want you to know that. Thank you for your persistence. And I'm so grateful that our tribe had a public health division that could step in immediately, and we'll forever be grateful for that. Something I want to share is the census information that Lisa was referring to. The census is going to be in the mail by April 1st, and it's imperative that council at your community meetings talk about this. And the reason being, we need every Cherokee citizen to make sure they check that there is a Native American, and it doesn't matter if you're 1 or 4. And the first name to list on the census form will be the Cherokee citizen. And at the bottom of that question, we need you to list Cherokee Nation. And the reason this is so important is that they estimate that for every person that is omitted, family that's omitted for being Cherokee, or for every citizen, they estimate it's a loss to our tribe in a period of a decade of 10 years of $50,000 to tribal funds. So it's really imperative, if you can, at your community meetings, to be sharing this information. I mean, it's $50,000 a person, so over 10 years, so it's very, very important that we get that information out there. And the other thing I wanted to ask about was the HPV vaccinations. 165 students. Are we going to do all these schools in Cherokee Nation?
We're doing them at the request of the schools. So we're happy to do as many schools as call and ask us. Actually, we're actively looking for schools that will let us come in and do the education, but it's ultimately up to the school district to ask and allow us. We've offered our services, but if it prevents.
Do they get a letter, I mean, to, I don't know, what, the superintendent of schools or something, saying that we can come in and give information on a vaccination that may prevent cancer? I mean, is that possible that we can do that, address it from that standpoint?
I think it's possible, yes. And what we are relying on at this point is if you look at our public health educators that work out of our healthcare facilities, but work in our communities and schools, have relationships with almost every school in their area. And what we plan to do is provide more outreach via those public health educators to go in. Now, in some of the schools, I don't know. I think it differs from district to district, but some require that the presenter come in and do a presentation for parents. It depends on whether the school has active or passive consent for those type of educational sessions. So we will continue to work on that and get the message out. It's important to do.
Thank you. And then one other thing, I want to thank you again for the abbreviation list at the back. Thank you for that. I've often kind of, okay, I should know this, but you gave us a reference guide. We appreciate that. Thank you.
I was thinking of you when I did that.
Thank you so much.
Before we leave the Stillwell survey, who actually pulled the trigger to roll that out? Was it the CDC? Was it the Washington Post that figured, hey, this seems like sensationalized news? Was it the Washington Post that actually pulled the trigger on that?
We say that, much to the chagrin of probably the CDC, it must have been a slow news day somewhere, and when they released that, someone that probably wasn't familiar with that kind of science just went straight to the table that went one to, here's the worst, and then just went with it that way. In speaking with the CDC, it was never the intent to use it as a measure necessarily of health. It, as Dr. Gann has stated before, what it was a paper in looking for solutions of how to determine health status in small population level at a small level rather than an entire county. So I would say it squarely was the Washington Post. Now, what I would say is that at the next meeting, at the Tribal Advisory Committee meeting, I've prepared some comments and some testimony regarding when the CDC does these kinds of things and sees that it's going to be released to the public, and they should obviously review that and see if tribal nations are impacted in that, and then we should at least have a heads up before it is distributed. The states get that before they distribute state health statistics. They let them see them prior to the release, and we should be afforded the same ability to look at that before it's released to the public.
Okay, thank you. John?
Yeah, I was thinking some of those guys that we're talking about now, who did what. I've got one class after lunch, then I got a planning period. Then right now, between seasons, I got about 2 kids for a PE class last hour. And sometimes I'm like, am I getting paid for this? So that kind of reminded me of some of them guys running around getting these different statistics and getting it wrong at the walk. But they got to be wondering, is this actually a job that we're doing? But seriously, on this census that's coming out, where's that coming from? Is that the federal government? All right. How often do they do those?
Every 10 years.
Every 10 years. And do we have plans for a campaign? Getting people to do it?
Later on today, you guys will actually hear a budget proposal, about $100,000 for us to go out and market. We've already started several things, identifying target areas. Sorry, Councilor Buzzard, but one of our lowest response rates in the 14 counties is Wickliffe. And actually, Jay. It's right, maybe, I can't remember exactly in districts if it's going to be yours or Mike's, but so Wickliffe, I think our response rate was about 38%.
Oh, I thought it was lower than that.
Yeah,
I thought they said 5%.
10 years ago.
Yeah, and so, but that trend, I think in 2000, the response rate was about 41%, as opposed to Councilor Austin's district, where we had upwards of 76% response rate. And so we're trying to target and identify those. We've been working with the pastors associations to try to get that word out to communities. We're working with each of our departments. We're working with the businesses. We're talking about letters that go out in communications, trying to incentivize that. We are trying to get technology such as iPads and assisting people that may be at community meetings for them to actually fill out that questionnaire. This will be the first year that you can actually do this with an electronic device.
Let me ask you this, Todd.
Yes,
So
sir.
the 50,000, potential 50,000 that we're missing on per, now, where's that money, 50,000 going?
So that is a number that's provided by the Census Bureau. And basically what that equates to is for every citizen that's not counted correctly in that district or that census tract, federal funding in one vein or another that comes down equates to $50,000 for every citizen that's not counted.
Okay, so what we're spending now is just potentially two families.
Yes.
50,000 plus
Yeah.
50,000 equals 100,000 kind of deal.
But what we're trying to use is our existing internal resources and things that we can do. This $100,000 is literally for ad buys and spending money in marketing. We are employing each of our employees and trying to create a network throughout existing resources that are already there. So,
Have
you
you
know,
thought-
our in-kind will be much greater than the 100,000.
Have you thought about any dinners in the communities specifically for that?
Yep.
And I know everyone here can draw crowds. Me and that boy over there, we can get you a crowd to fill out these surveys. You know, if you're thinking about that
Yep.
as well. And, well, good, because I was just sitting here thinking, I try to be nice to people and figure I'm a pretty good guy, but I can't remember ever sitting down with my family and filling out one of these. I got a few good buddies that come over to my house, and I bet on, now I'm not talking to everybody, but some of my old good buddies, I can bet they haven't either. So, if it's important, like we're saying,
And
it
this
would
year's-
behoove us
Yeah.
to campaign the heck out of it, because like I said, I'm betting a whole lot of folks, not just in my area, don't do it. And if it's worth 50-something thousand, by golly, I'm ready to help you spread the word.
Mr. Chair, can I interject
Well,
something?
I got the floor here just a second, Keith.
Well,
Remember how you
this'll-
did me the other day, banging that
this'll
gavel?
add
Hold
to
on a
it,
second.
actually.
But, just kidding.
I've asked Gene Perry to come to our March Education Committee, which is essentially the same day as the people can start. That's the mid-March is when the census is actually available to fill out online, and that's the same time when we're meeting. He is the government relations person who is in charge of this
All right.
process of educating, and he'll be presenting to us at that moment, the moment that it is, to help bring us up to date as to how we can be involved in this
Is he
process.
coming down to Adair County?
No, but he'll come here for all of us.
He probably will, Sean.
Yeah,
And-
awesome.
And the thing that has been discussed is the fact that the tribe must get involved because your people trust you, they trust us. They don't trust some government census workers.
Right.
And to speak to the 50,000, finance says there are certain programs that you must use federal census data. Other ones, we can use our data, but some of them are like, we're not taking your numbers. We want the census data. And so that's why it is so important.
Well, I'm glad to hear there's a
We've actually
campaign
been-
plan.
This group's been working for several months. We've been working with the Census Bureau as early as about a year ago, identifying census designated places in our historic tribal communities and getting that identified and updating our boundaries on each of those. So we've been working on that for almost a year.
I'm just curious, am I the only one that can say they can't remember? Filling out a census?
Probably so.
I can't remember.
Is it possible, Keith, that he could come to our February meeting because we're going to miss the opportunity to address a lot of our citizens?
Our
at
February
community-
We've already
is
had our
fine.
February meeting.
Oh, this is February, isn't it? Okay.
It's the next meeting, which is about 15 days from now.
Excuse me. Okay.
But we,
Wrong
I'm
button.
excited about helping, getting the word out.
Hey, Dora,
And also, Todd,
that's not me through.
these surveys that these fine people do are great. Now, I remember before the story came out about our town of Stillwell, before that was when I raised my hand and started talking about Marcoma. I mean, it was before this, about getting all of us some funding for that. So, I have faith in what you guys are doing, but just know I'm kind of like a little kid anticipating Christmas, and my folks are too. Canaan's folks are too. You know, they are.
If I can
they
just
are
real
excited.
quickly update on that, I sent David Moore and crew down to Cherokee to evaluate that facility a little bit more, since, you know, they went out probably 6 months or so ago when we started this conversation, and we found some additional vandalism where the entire second floor has been removed. And it was there 6 months ago. So I've got them trying to address security in there so we don't suffer additional losses. But they are working on a plan to bring that facility, you know, what would cost us to do that and what we can get done. So we're working on it, but we did have some additional vandalism that occurred there just within the last 4 or 5 months.
Well, thank you. And once the word gets out that you guys are really coming through with something, that community's ready to help with security and watching out for it, and they'll take pride in it, and might borrow a few surveillance cameras from the casinos. I think it'll be a great thing. Thank you.
Dora?
Regarding the census, I've already done 4 workshops in my district, and while the turnout was somewhat low, I realize it's still early in the process. But get with Gene Perry, because he came. They've already got, brochures printed up and ready to go. The census is going to work out in phases, and the mobile assistance app is going to be available March the 13th. But what I did was I went out in my community and I found the West Side Community Center. They have the after-school program for kids, but they have a state-of-the-art computer lab there. So I'm working with them, and we're going to offer special times. We're going to actually even have a census worker that's going to be stationed there that will help people get online. And I'm going to do some feeding, special days that they'll be able to come. And the public library will offer, most likely, a computer for people to come in and use.
Now, does it have to be online?
It doesn't have to, no. You can do it on your phone, or you can do it on paper, but it works out in phases. Once it goes a certain point and they haven't heard from you online, that's when the people door to door are going to be coming out to try and get those people.
Yeah, and well, thank you, Dora. I'm ready to help.
Chief of Staff?
If I can, to Councilor Austin's point, Gene can come in and outline that. This year, the Census Bureau has done a lot of work in advance of trying to find those addresses that they've gotten returned mail back from, so that they're not sending out people and paper and mail to those places where they know. And so they've been working with the United States Postal Service, HUD, and others to identify those pockets, and so that they don't have erroneous information going out. But there are several phases. The last phase is what we consider the old census takers, where they come door to door to fill out your paperwork. That is the last phase, and they only send those out if they have not been able to connect in the 3 or 4 other passes that occurred prior to that. So we have lots of opportunities to try and connect with our citizens first, to try and get the technology and resources in their hand to get them to do that before we physically send census takers out. And we are working with Census Bureau to also help them staff that in the event that we have to have census takers physically hit the ground. But Gene can address that a little bit further and provide you guys a pretty good oversight of that when he's able to come in at the next meeting.
So there's a paper form they can fill out?
Yes.
So have old Gene just know again that, just me and Kana, we can have a night at Bell, we can have a night at different places, and old Gene won't have to worry about Adair County. Thank you.
Harley?
I just, sitting here thinking about the census data. We have every Cherokee that's registered in the registration department here in the Cherokee Nation. Are we utilizing that to help with this?
Yes, sir.
So we should have everybody on record already. Send them a letter. Say, this is important because you get $50,000 a person if you register the census. So to me, that would be worth a $100,000 mail out. My comment.
Thank you.
Still nice.
Dr. Gann, floor is yours. You're gonna address the coronavirus.
Sure.
Among other things.
Yep. So, as you've noticed over the last several days, the situation has developed globally on coronavirus. I think the hardest part the experts are having is we just don't know much about the virus, how it spreads, and new reports are coming out. Over 82,000 cases now. Korea has lost control of the spread of the virus. And the latest data tell us that the mortality rate is about 3.5%, 3.4%, compared to influenza, which is about 0.1%. The over 47 countries now, and what's particularly concerning to our discussions with the state epidemiologist yesterday is that where the virus is now spreading in Korea and Japan and Italy, there are a lot of U.S. citizens living there, and we have nationally a system to help those people come back to the United States if they want to, and the states have monitoring systems. So in Oklahoma, we've had 60 people come back to Oklahoma from an area with coronavirus is endemic, and they've been monitored, and the state has been very successful, very active monitoring twice a day, checking on them, checking their temperature, make sure they're not getting sick. We've had no cases in Oklahoma. But you can imagine watching what happened in Korea and in Italy and Japan. It's just going to take a few cases for coronavirus to take off in the United States. The experts are now saying it's very likely that will happen. So I've seen just over the last 2 days from the national level all the way down to Cherokee Nation, the emergency management departments are standing up, pulling out their all hazards emergency management plans and talking about through the different scenarios. We have meetings set up tomorrow for that. Our relationship with the state is intact and our communications are very good, both through our emergency management, through the Marshal Service, and in our health department as well. So we're confident that we'll have the plans in place and wait for it to happen. We're going to be prepared. Yes, sir.
Yes, Doctor. Earlier in February, Cherokee Nation, we didn't have the test. Do we have them now, or planning on getting them? Or?
CDC developed the test for the virus, and right now I think there are a handful of other states that have it. It's not a simple test and not easily replicated. The state epidemiologist expects Oklahoma to have the ability to test that soon. That's the best he could tell us. There were some problems with the original test that took CDC a while to straighten out. So it's not widely available. It's not available in Oklahoma. Our samples still go to Atlanta. Remember, the coronavirus is the same virus that causes the common cold. So we have a machine that tests for different strains of the coronavirus, but not this strain specifically. So there might be people that present to our health system that get tested, and someone tells them, yeah, you have the coronavirus. It's not this one. It's not the COVID-19 novel coronavirus, because that won't show up on our machine. And the reports coming out from the media are really up to date, and up to now have been very accurate. So listening to the media of what's going on and recommendations is reliable all across the board. And CDC daily is putting out recommendations and updates. So.
Mary?
Are we in a pandemic?
Not yet.
What is the number that you hit before it is?
So the World Health Organization has their definition, and there's a little gray area. So if you look at what happened in China, where things got out of control, right? So they are, instead of a containment mode, they were in mitigation mode. In Korea, they lost containment and went to mitigation mode, and it feels like Italy and Japan are starting to lose control. So there's a certain, when that happens in a certain percentage of countries, that's when they say, okay, it's a pandemic, when the spread from country to country is uncontrolled. We did have the first case in California of a person who was positive for the virus and they don't know where it came from, or who it came from. Every other case has been someone who traveled overseas or was a very close contact with someone who had traveled overseas. So we call that community spread, the first case of a community spread. Some experts are estimating there are 100 or 200 people in the United States who have the virus and don't know it and are out walking around. We don't know at what point a person becomes contagious, how many days before symptoms and how many days after symptoms. There are reports that 12 or 13% of people after they recover from the virus get sick again. So it's like we don't know how many. There's some math they do to determine how infectious a person is, to compare viruses. And so far the data is telling them this is very contagious. So again, compared to influenza that we see every year going through, we have tens of thousands of people in the United States every year die from influenza. But a lot more people get it. The mortality rate's only 0.1%. For this COVID-19 coronavirus, the mortality rate of 3.5%, you can just see the difference. I think what concerns me the most is the data are telling us that up to a third of people who become sick require intensive care unit. We don't have that many intensive care units. So, in Oklahoma, we have an outbreak. That's what our emergency management teams are looking at. How are we going to take care of the people that become ill? And then the doctors start getting ill, and the ambulance drivers and the nurses and the housekeepers and the dietary staff, and the schools close, and in all the worst case scenarios, right? So we're making plans for all that.
Bad timing, right in the middle of flu season, old Corona come,
Yep.
right? And
Yeah, so how do you
can't test for it.
how do you know? If you get
doctors-
sick, right?
I mean,
So we're
we might
talking
be
about
prescribing the flu.
telemedicine, so people can call in instead of coming to the hospital if they're sick, and figure out we can differentiate between the common cold or influenza or the COVID-19. But it's going to be day to day.
well, excuse me, Doc, but we appreciate you guys so much. Just the more you learn, just send us an email.
Yes, sir.
There's people asking us daily.
Yep. Our communications department is an integral part of our emergency plan. So,
Well, thank you.
yes, sir.
Sorry.
I think you kind of answered most of it, but say someone walked in our clinic, thought they had the cold, and we went and put them through the whole process, and they found out, will our clinics be shut down? Will that staff have to be quarantined?
I don't think so. We put plans in place. We've already had plans about what to do with respiratory infections. And the staff have been kind of retrained and reminded of that. So it's not like Ebola, where someone might have been exposed and we send them home. It's not like that. The exact plans of there starts to be a spread within our clinic, I'm going to refer to Dr. Montgomery. It's a little, I don't deal too much with the exact clinical response. So it's just it's going to be day to day to figure out how things go. It really is.
On that second time around, will they still can be infectious?
So I don't have any other data than that one number I told you, was that 12, 13% of people are becoming sick after they recover. I don't know if it's a relapse of the same virus they already had, like they never got rid of it, or if it's a reinfection. I haven't seen that yet. It's just fresh information.
Chief of Staff?
If I might, to touch on what Dr. Gann is expressing here, we have called a meeting across several disciplines, from financial resources to public health to emergency management to our facility operations. Should that get to the point, we're going to look at travel outside the state with our employees, because at any one point in time, we have several hundred employees that may be traveling to different locations for trainings and conferences. And so we want to look at this throughout our whole system, as well as child care centers and Head Starts. And we want to be prepared in the event that this happens. And making sure that we have a comprehensive plan to try and address it as much as possible. So it's not solely on the shoulders of our health team. It's a collective system that we need to try to make sure that we mitigate the spread of that coronavirus. So this will be the first meeting. I know that we will have additional meetings, but we may include more and more people as we start to expand and look at things. But we're going to ask our emergency management and our public health experts to help take the lead and drive the conversation and make sure that we're looking into all the areas that we need to make sure that we are on top of this before it gets to us.
We have a lot of all hazards, emergency management plans. We have continuity of operation plans to deal with natural disasters, infectious diseases, et cetera. So we've been thinking about this for decades, and the system is responding as you would expect. So very well.
Victoria?
Yes, Dr. Gann, I have
Yes,
a couple
ma'am.
of things. On the news, I've been seeing, I just wonder about this, I've been seeing videos in certain places where you'll see workers spraying down a whole airport.
Mm-hmm.
I'm wondering what they're using, what are they spraying with, and what good does that do?
I don't know. I don't think we know. The scientists know. We don't understand the virus and how it spreads. Very similar to influenza. You go to a classroom, in between every class, the teachers have the Clorox wipes and they're wiping everything down. I think it's the same thing. We don't know how long the virus, might persist in the environment. What exactly will take care of it, will kill it, disinfect things, but they're collecting the data and working
So
on it.
you don't know
I don't know what they're spraying.
what they're using to spray. I'm just wondering, what is that? What are they?
Yeah.
Okay.
I'm sure it's a disinfectant, that's, works on viruses. So
The second question I had was, is there any information yet about if this will be like other flus and influenzas that will have run its course, and when summer comes, it'll go away, or do we know that?
they're discussing it still. They don't they don't know how well, if someone becomes sick and they recover, how long they might stay immune, and will that last through the next year? The experts can't agree on that yet. It's just too early to tell.
Okay, thank you.
Sure.
Dora, did you need
You had mentioned emergency management was going to be having a meeting, and are we able or willing to work with other tribes with whatever we're learning? I had a phone call yesterday from someone at the Osage tribe wondering what, preparations we are doing, and I just don't know. He left the room.
But, yeah. Yeah, that's
Well, I can just talk to Todd then.
sure.
Okay. John?
So I think what Todd was getting at is the meetings you all are having, you're kind of keeping a thumb on where the outbreaks may happen. And Todd, was you getting at kind of the different trainings that we go to? Kind of keeping an eye on where the outbreaks are happening?
Sure.
And the traveling that we do.
My point was, I was trying to express there, is making sure that we look at everything. It's
Right.
not just what's here, but our contacts from at-large community meetings and trainings that go on. Understanding that we have to look at the entire system, and all things are on the table for us to look at to make sure that we try to help facilitate this.
Might have to
Stop and
postpone the
spread.
training if there's an outbreak in a particular state or something.
Correct. And we may have to look at those things when it gets to that point, but we want to make sure that we're monitoring that situation, and we've got a planned response prepared for it when we trips enough flags in our system for us to make that happen. And that's why we're talking with Treasurer's Office and others to make sure we've got appropriate response for that.
Thank you, Doug.
Just have a comment. Lisa, I would like to speak with you after the meeting about something else.
Sure,
Thank you.
absolutely.
Thank you.
I just had a quick question, Lisa, on, I think Sean brought up, I think you're looking at a place to bring a facility, to workout facility, is that what you're talking about over at Cherry Tree? Do we have kind of a layout of where other districts might be able to utilize one at? I know we have Marcoma here, but I didn't know if there's other, I know everybody probably could see that going in their own communities, a facility where you can have workout.
Well, what I think that's part of the purpose of the physical activity survey by district was to take a look, sit down, and talk about other alternatives. I know with Dr. Dobbins we talked about joint use agreements with schools. Because if you look at the nature of our communities and how rural they are, most of the science tells us if someone has to go more than 5 miles, they're not going to utilize a facility. So when you take a look at somewhere that has a lot of rural communities, we want to look at solutions that might provide joint use that would be a benefit for both the school and the community. How do we do that? What does that require? And I think it's going to depend from district to district. So we haven't made a long-range plan for facility construction or looking at where we would place them, mainly because, well, if you look in some areas, there are already physical activity community centers, and then some areas have absolutely no places to go. And then based on what we are seeing through the physical activity survey is even in places where there is a facility, the community citizens are still saying there's no access. So that's real interesting to me that we want to dig a little deeper to say, is it that that we don't advertise the facility enough? Is that the facility not adequate, or are the resources that we're providing not what communities need, or is it that communities really are looking at other things like roads and being able to travel by foot places and walkability and be able to get their exercise through their normal daily life activities as opposed to putting on their shoes and going to a fitness center? So I would say that the opportunity exists now to set up those individual meetings with us, and Dr. Gann and Dr. Garrett lead those, and we also bring in our community health professionals. Julie Deerenwater Anderson comes in with recommendations that we have used in the past, and so we'd be happy to sit down with each individual council person for your district. So,
how's the response been? I know that they have 13 of them over in Choctaw Nation, different wellness centers. How's their response been for, I don't know, maybe is there numbers that have we reached out to them, and can we get numbers of how often those smaller rural areas that they have, and also how they're funded? Because I think they probably fund theirs a little different, because they have one of them looks, architecturally is just
actually I'm working with Chance Adams, who is the one that was in charge of putting most of those in place, and we're having a lot of discussions about what they did there. One of the things that happened with them that he and I both talked about is that while you're correct, they built them with tribal funds, but in the last 2 years they have switched them over to the health division to operate, and that's caused a lot of issues because if you operate them under your compact, then you start limiting the people who can access that facility. Because we have looked at that for Marcoma, and if we were to do that with us, it would limit the citizens, or it would limit the people who can actually come and use the facility. Because then it's deemed under their compact dollars, and if they allow non-beneficiaries to come to their fitness center, all it takes is for one beneficiary to say, well, I can't use the equipment because there's too many non-beneficiaries in here. So when you look at it from a community perspective, that might cause some issues. As far as the longevity of it, I do know that they had some great success in the beginning because of the nature of the facilities, which are much like Marcoma in the sense of they have recreational opportunities, they have basketball leagues, and they have CrossFit, and they also have a children's program. Right. But as far as I think the sustainability of them is certainly a question that he and I have both been discussing, and I don't know what their plan is for sustainability because they have a lot of them. Right. And that's a huge cost.
Right? But it's, I mean, the services that gets provided, regardless the cost,
Absolutely.
kind of those things you look at it and you say, well, yeah, it's a lot of cost, but it's providing
Absolutely.
X, Y, and Z. How can we
Absolutely.
continue paying for those costs?
I completely agree with you, and I think that is the perfect way to look at it, is to take something that we're doing in public health. While we want to be efficient and effective with our dollars, we also have to lay over the top of that the mission of the Cherokee Nation, which is to ensure the story continues. So while we balance that idea of spending money and making money, we also have to balance it with the idea of who are we here for and what are we here for.
Right, right.
Yes.
Yeah, because if you look at all the other ranges of forms of health services, you look at the way IHS sets up, they're never a balanced budget. They're always in the deficit because
Right.
they provide a service, and that's ultimately what we do. We want to be as fiscally responsible as we can, but at the end of the day, how can we just make it happen? That was just a question I had on how their facilities are set up, and I'm glad that you guys are in contact with them.
If you'd allow me to comment just again, I think that and when I'm talking about exercising sovereignty and really understanding how to develop a tribal public health department that fits our needs, because we're really still in our infancy as a tribal public health department. But I think those are the things that we talk about, and we figure out how do we do it, and how do we develop these partnerships, and how do we capitalize on all the things that we have together somewhere to do it in the most effective way, and that's going to look a lot different probably in each area.
Right.
And I'm glad that we're talking about that.
Yeah.
So I think it's important.
Yes, absolutely. Appreciate it, Lisa.
I think each of you will really learn about your district whenever you have a chance to sit down with Dr. Gann, Lisa, and Dr. Garrett at the back. Dr. Garrett, could you raise your hand? Dr. Garrett, who was responsible for a lot of this surveying and research, and I think a lot of us, at least I learned a lot about my district in that presentation. I thought what was interesting, you mentioned too, I didn't realize that at Marcoma, did you say like 90% of the individuals live within 5 miles of the facility?
I think it's close to that. We've looked at about what percentage that serves, and a lot of the citizens that utilize Marcoma are employees, and but it also provides a family environment because you have childcare, you have basketball leagues, you have other things that people can do.
I don't think, in general, our Cherokee citizens aren't willing to jump in the car and drive 20 minutes to go work out.
Right.
I think that's national. That's across the country. That's just science across the country to say, that if something is not within a close proximity and you're getting a busy day, then the likelihood that you're going to go home and get your clothes changed and drive back to somewhere is not great. So we need to find ways to make it easily accessible.
Okay. Any other comments or questions? It looks like it's about high noon. No old business, no new business, any announcements?
I have one that I wanted to say real quickly. Since the last meeting, Public Health wants to formally welcome the health research program to our area and to our programs. Organizationally, they started working in our area back in December. Dr. Sohail Khan, who I've worked with for over 20 years, we're very pleased to have them working with our team on a daily basis. We've already figured out ways that we can really enhance our services together. And I want to mention that Travis Wycliffe, that works in that department, is the first ever certified Native American tumor registrar. We're very fortunate to have him working in public health, and we're pleased to have them. So in the future, you're going to hear more about public health research priorities. So thank you.
Okay. Well, I know we all appreciate our public health department, their commitment, their expertise, and their ability to communicate. Like this today. So, I would entertain a motion to adjourn.
So moved. Second.
I would say motion carries.